Today. Right from the onset, morning, different classes, observations, and so many things. Still in school, but it's good. Matron, how did your day go? We can't hear you. You're mute.
It was something else. I'm always very busy.
I know.
I was
I know.
busy. I'm at the mind thinking about period this time, and so I had to do whatever I had to do to be here.
Yes. Thank you. We appreciate that, and we're not taking that for granted. And thank you, everyone, for joining. Sarah, Esther, Irene, Yanda is also here. Please, can we share reminders to people to join? We are about to start, and today we are going to explore different things. And I'll just hear from Matron how she has been dealing with working with us, cancer warriors and cancer survivors, just to be able to support us. She's been doing this for years, and it's going to be an interesting day for everyone to learn, to grow, and to explore. So we have 1 minute to go, and if anyone wants to unmute and just share how their day went, that would be okay. Irene, Esther, Sarah, Yanda, how did your day go? While we wait for other people to join us.
All right. Good evening. My
Good
name is
evening.
Ahmed. I'm glad to be part of this and joining this again this evening. And so my day has been wonderful, though even though it has been work overload, but at the same time it has been productive as well as also stressful. So I'm
Hmm,
glad to listen to our guest speaker this evening, and I will be following throughout the program.
thank you so much. Thanks for sharing. Esther, Sarah, Irene, do you want to share? We can also use the chat to share. Some other people are joining us. That's why we are giving them extra 1 minute to join. And we'll kick off. There's a lot of things that we want to discuss today. There's a lot of things that we want to discuss today, a lot of things that we want to share. And it will be glad if we have more people join us. But in the next 2 minutes, we are going to kick off. We are just sharing how our day went. Welcome, Yobosa, and welcome, Ellipse. I'm there to hope. There's always hope somewhere. Welcome. We're just sharing how our day went with all the bustling and cracking of Nigeria. Hope we are settling in every day, and living our dream life. Okay, so we are going to start. Welcome, everyone, and good evening again. It's another episode of I've Got Cancer, So What? And we have a guest in the house, and she's someone that has supported so many of us, myself also, throughout our cancer journey. In fact, she's a well-known name. There's no need to read her bio. Let me just explain to you. She's a well-known name when you talk about cancer support. Um, I got to know her from someone when I was diagnosed and when I started my treatment. And then when you start asking questions, oh, what do you eat? What can you eat? How do you manage this one? What do you do? And somebody will say, there's this Metron. Oh, just be part of the WhatsApp group. You will learn a lot. This one, that one. I think for her, two people linked me. Initially, I didn't just want to be part of any WhatsApp group. I just want to like thrive. And because I went public with my cancer journey, there are lots of people coming to also like learn from me. I said, okay, do I want to be part of any WhatsApp group? There's so much in my head at this time. But at the point I got that invite again from another person, I said, okay, let me come here and really know what's happening. And that's how I got in and I got stuck. Um, like it was so beautiful that every day there's something that you're learning. It might not necessarily be something you want to learn. It might be hard, but you keep trying. You keep trying. Some of them will be asking, do I really need to do this? But some other ones, you're just like saying, why not? If other people are doing it, why can't you? So she has been, she's an experienced nurse and with 36 years of experience. That's not moi moi. That means she knows the drugs, she knows how for you to go through it. And she's been working with us cancer survivors and warriors for over 9 years. And that's quite impressive. So she knows what she's talking about. It might not be what you want to hear, but sometimes it's also good for you to do your own research when you hear things like that. So she'll be talking to us today, and we are so excited like to learn from her. This month at Flourish Cancer Wellbeing Initiative, we are talking about envisioning your healing. And last week we had a survivor who came to talk about what the doctor says to you and what you believe in yourself. Today, we are going to look deeper into how your mind and your body connects in your healing. Your mind and your body, how does it connect in your healing? And Matron will take us through. So, everyone, please let's welcome Matron as she takes the floor to introduce herself and tell us why she's dedicating her life. She's supposed to be retiring, really, or retired already, but she's dedicating her life to cancer survivors, to warriors, just for us to live. Matron, over to you.
Thank you so much, Flora. I am so happy to be part of this initiative. I mean,
Thank
I
you.
am happy. God bless you.
God
You
bless you
know,
too.
in creating this platform of awareness is like an outlet of wealth of awareness and knowledge for people to successfully treat this cancer and stay healthy, not just treating, but staying healthy, keeping your head afloat above the sea level. You don't allow the water to sink you. So I am so happy to be part of this initiative. You know, like the other speaker the last time, he said something, he said, knowledge is power. And we're always hearing knowledge is power. And why is it power? It because when you have gathered enough knowledge, it gives you the ability to make informed decision.
Yes.
Just taking any decision, but an informed decision that will lead you into this, what we are talking about, envisioning your healing, visualizing your healing. Your healing, is it in the next 20 years, in the next 50 years, in the next 100 years, 120 years? And so when you have this knowledge, it gives you the ability to make an informed decision. It helps you to understand the concept of what you are actually into. Because some people start the treatment without really knowing what they are doing. They
Yeah.
don't know. And so at the end of the day, they're bound to make lots and lots of error. And human beings are, we were we were molded to make errors. And so when there's an error with one diagnosis, with one lab investigation, you fall a victim when you follow that process. When you follow that process of the wrong diagnosis and the or misdiagnosis. But when you come to a place like this and you know that you can actually go elsewhere to keep looking at what you are going to get until you finally make your informed decision. Thank you so much. Thank you so much. Thank you so much. And I was actually waiting for this question. What brought you? What made you come into here? You are not a cancer survivor. So what happened? I will say that it actually is back when I was small. I discovered that I had this passion for very ill people. When I was even in secondary school, if I see somebody walking on the road and I feel like it's somehow in my mind, I'm praying for that person. And so it has been going on and on. It keeps expanding. And when I entered into nursing, I discovered that most very ill patients, they're attached to me because I'm always looking at them. I'm always with them, always encouraging them. And I remember there was a time that we had, when I was just a young nurse, we had one patient, HIV patient, that was rushed to the hospital. All the nurses ran away from this man because of that tag, HIV. So nobody wanted to attend to this man. He could not help himself in any way. And at the end of the day, I was the only person that walked up to that man, start feeding him, start bathing him. And unfortunately, I was so young then, I didn't even remember to wear gloves and all that. But somehow, God protected me in my ignorance. So that was how it started. And then when I left Teaching Hospital Calabar and I came over to Lagos, I must confess, I was not satisfied with my bedside nursing. I was never satisfied. And I thought because I wanted to be a lawyer, and after I did JAM, I passed, my father said, nobody in my house goes to read law because they're all thieves, they're this and that. And that was how I didn't even know that God was programming me into nursing, because I could not go. I had the admission, but I could not go because my father refused. And it was so devastating for me. My father said, you must read nursing. I said, I don't want. You wouldn't believe, they took me to the exam room, no pen, no paper. Somebody gave me, and I sat down, I looked at the paper, the exam paper. I was writing C, B, A, D, C. I did not read anything. For all the subjects, I didn't read anything because I didn't want to pass. And so when the result came, I took sixth position. Can you imagine? How serious is this? I was so sad. People were rejoicing and I was very angry. I went for the interview. Out of 100 of us, they wanted 40. And I said, okay, this time around, they will not get me. And I got the people who come out. What did they ask you? What did they ask? I was just there. And when they called me in and I entered and I sat down, now said, one person just said, if we didn't give you this job, this admission, what would you do? I said, I'll be very happy because I want to read law. All of them started laughing. And then they said, stand up. I stood up. Say, walk around. And I walked. Say, sit down, but you're walking like a nurse. You're looking very smart. I'm telling you, they didn't ask me any question. They were just pushing me around, and then they said, you can go. And I left. And I came out. What did they ask? Hey, they didn't ask me any question. And the result came out. I was number 4. And then I now knew that God really wanted me to do something. But funny enough, I entered nursing. I did not enjoy bedside nursing because I didn't have that satisfaction. So I came to Lagos and I was looking for what to do. I got a job in a hospital. I was a chief matron there. I was working. I put in all my energy. But I discovered that I was still drawn to very ill people. And then it now happened. We had this cancer patient in the ward. I was so attached to her. I was so attached. And that was when I knew that. And then the rest is history. And I started developing myself. I now connected to a cancer organization and I blew. In fact, I got my own satisfaction. I was happy that so I didn't have any inkling about cancer, but I just developed myself. I went into studies upon studies, and then I got what I needed to start with. So that is what I can tell you about how I got to where I am right now.
Thank you so much. That's so amazing. So sometimes, like just the way you were just describing, and this afternoon I was telling someone that I've been running away from something, but every time I run, then God or faith will bring me back. I don't know why, but it just happens that way. And it's so amazing how faith will always draw you to what it wants you to do. So I'm glad that even as you ran away from not doing your exam, went to the interview, but then the universe wants you to be part of some people's life. And that has really, especially for me and for every cancer warrior or survivor who you have impacted. And just for you to also continue from where you stopped, if there's something that excites you about working with cancer people, what will it be? Let's start from there. If there's something that excites you about devoting your time, working with them, talking to them, even sometimes we upset you in the group, but you are still there supporting us, what would that satisfaction be?
The satisfaction is seeing people smiling. My satisfaction is when somebody walks to me in tears and is living with joy. Just putting smile and giving people hope. That is my satisfaction. The hope, the joy, because cancer diagnosis, is crazy. It's crazy. The shock and everything. I have seen people going through so much shock and hopelessness. And so when that hope is restored, that joy is restored, that gives me so much joy. That gives me so much satisfaction. That's just it.
Okay, so that's so beautiful. Now let's talk about envisioning your healing in terms of body and the mind. If you want to summarize it to a layman that is thinking about maybe a child of 11-year-old who just got diagnosed with cancer, and you want to explain to this child how your mind can be part of your healing, your body healing of cancer, what would you say body and mind collection means?
Okay. When we are talking about body and mind, I will make it very brief. There's a connection between your body and your mind. Your body cannot work in isolation, and your mind cannot work in isolation. Both are connected. And so, whatever your mind is telling, if your mind is releasing negative thoughts, fears, definitely your body will respond to that. Now, I want to explain that the our brain, the nervous system, all the organs in our body, the endocrine, the nervous system, and emotion, and our emotions, that is our thoughts, share one common chemical language. They understand that chemical language. They communicate with that chemical language. And so when the mind releases, when the mind is sick, when the mind is saying something, if it is negative, it communicates these negative vibes to every other organ in your body. That is a chemical language that all the organs in the body has. And so you cannot treat your body different from your mind. They work together. That is why when you have, when that's why as a Christian, the Bible says you should renew your mind. Because when you don't renew your mind every day and you dwell on something, you see that you become what you are thinking. You become what your mind tells you. You become what your emotion is saying. So even as a child, I will be able to tell the child should look beyond the pains. You should look beyond the diagnosis, because once you start having negative thoughts, fear, whatever we are calling negative thoughts in this concept is fear. Because this, when you have fear, it affects all the organs of your body. Now, when your mind has a problem, maybe is sick, or you are thinking, you are afraid of something, like number one, the first thing that comes when diagnosis of cancer comes is the fear of death. That's the one that comes to mind. Once you start having that fear, your hypothalamus releases some chemicals into your body. That when that chemicals, normally fear is a normal occurrence, it's a normal emotional response, and it is not a sign of weakness, and it does not mean that it's going to predict whether there's going to be a poor outcome or a good outcome. But fear, when it gets out of hand, it releases these chemicals that affects your heart. The first thing is that your heart starts beating very fast. At times, some people, you want to go to toilet. That means, see what your mind is doing, controlling every part of your body. And so if you're controlling, if your mind can think better, think positively, that this thing is not going to kill me. This thing is not another step in my life to move on higher to a different realm in life. You discover that you will scale through. It might not be easy, but you will scale through with much ease than somebody that is dwelling in negative thoughts, negative vibes. Every time you are being negative, you are afraid because you notice that somebody had the same issue and things went wrong. Now, cancer journey is a personal one. You cannot generalize it. You cannot generalize it. So when you start thinking about somebody, okay, for instance, this person is triple negative, another person is having triple negative. Both of them took the same chemo. This one, the cancer dissolves very fast, the tumor goes very fast. And this one, the tumor is there. This one is looking at the one that he has recovered. And he said, this thing is not working. And then that fear start coming in because he or she is trying to pair up himself with another person, forgetting that your body mechanism is completely different. So that is why I said your mind and your body matters a lot in envisioning. Envisioning is a long language. Let us say survival, looking at your survival, visualizing your survival, visualizing your healing. How do you visualize it? If you are visualizing it positively, you are going to see that your journey is going to be very smooth. It might not be that smooth, but you will reach your goal. But when you are visualizing your healing and you are thinking that somebody died, I saw someone died the other day, and then you think you are going to die. Another thing is that thank God you are in the group. You see somebody, a doctor prescribed Zeloda for somebody. Another person, and then the person will come online because she has heard that Zeloda is very bad. Zeloda is this. Zeloda can kill. Who told you Zeloda will kill you? Just because one person reacted to Zeloda doesn't mean that you are going to react that way. And so people run away from treatment because they decide to be fixated at a particular point. They get themselves fixated because they saw something happen to another person, and they don't bother to know that their body mechanism is different. Can I shock you? A lot of people here, I'm very sure 80% of people here take Piriton. I don't. If I take Piriton, I will land in emergency. And that's my body mechanism. That doesn't mean that Piriton doesn't work. And so I get something else. And so when you are taking a particular medication, you are taking a particular chemo, and the doctor has done some tests, you realize that you are not responding to it. Fine, it is painful because you have spent so much, and then you are now going to take another, and the doctor says you are taking another chemo. You say, I'm not taking it again. How am I sure it will work? And so we need to leave that mindset that what works for A must work for B. No. And so you need to have this positivity around you, even though it is difficult. And that's why most of the time, we use prayers to cover a lot of things. You pray in fear, you are not getting any result. And you keep praying, you're not seeing any result. And you say, and you're seeing people testify and you are not there. When will it happen? Have you checked your mind? Is your mind and your body aligning positively? Are you working with people that are toxic? Now, another aspect of it is this. Now, you are diagnosed of having cancer, and then you go through all the stages. You see somebody living in denial. The person stays in denial. Once you are fixated in denial, you don't want to move from there. God forbid, nothing is happening to me. How can I be? Especially stage 1, stage 2, part of stage 3, you are not feeling anything. Nothing is wrong with me. I'm fine. At the back of your mind, it is the fear that is making you fixated at that point. And then that cancer is not waiting, it's progressing. And meanwhile, you are fixated at a point. You're not ready to move. You are not ready to do any treatment. And then by the time you are moving, or somebody that's been able to move from that denial stage, it gets into anger and becomes so angry, so aggressive at home. Now, we are talking about visualizing your healing. You are visualizing your healing, and you cannot do it alone. You need your husband, you need your children, you need relatives around you, you need friends, and then you become so aggressive to them. How do you visualize your healing? Being alone. And now you see somebody say, my husband ran away from me. How was your reaction when you enter from, when you have, because when you left that denial stage and you go into anger stage, anger, depression, and then at that stage you are angry with your husband, you are fighting your husband, you are fighting your children, everything irritates you, everything annoys you. Have you forgotten that you need them in this journey? Have you forgotten that you need them with the care? Because at this time you need the love, the care of your husband and your loved ones. But once you start reacting negatively, when you start reacting, please, if you are listening to me, remember that you need these people. That love, that way that you were behaving for your husband to love you, you still need to make it. In fact, this is the time for you to show him that love, because you need his support. But when you don't, the man walks away. And then we can now hear one-sided story that the man walked away. What happened that this man walked away? This man that loved you so much, why did he walk away? Yes, we know that some walk away. Some walk away, but there's people that don't walk away because the wife has cancer. They walked away because they could not continue with the excesses of her behavior. You want the husband to pay you from A to Z. You want the husband to carry your leg up. You want the husband to do everything for you. You can't even use your hand again. The more you are not helping yourself, the more you are not working, you dive into depression. And so at this stage, your mind and your body, they are at loggerhead. And so you are going for treatment. They are giving you something because you're already having a warped mind. And you are taking this, and your mind tells your body, this cancer, this treatment is not going to work. And here you go. And then I'm going to tell you a very short story, very brief. And then you are going to hospital to take treatment. You already have in your mind you are going to react. You're already preparing yourself for vomiting. You're already visualizing yourself the way you are going to vomit. You are visualizing how you're going to have diarrhea, how you're going to stool. You are visualizing everything that is going to happen to you. It will happen because your mind has already sent signal to your system. As it enters, it's going to happen. Now, let me give you, I said I was going to give you a scenario. There's this lady that came to me one day. She was crying with all her heart. She cried, nobody cares, nobody loves me, I'm dying, I have a recurrence. And her axilla was so large, she could not put her hand down. What happened? I have a tumor, a recurrent. My husband doesn't want to hear anything. My husband, in fact, he wishes me dead. Nobody cares. The church, I went to church, nobody cares about me. Now I'm telling you how this mind works. And then when she came and she started crying, as she was crying and talking, I couldn't hear one thing. I said, I can be very, very dramatic. I went and brought a bucket and put in front of her. I said, yeah, start crying. Cry until you feel this bucket. If this bucket did not fill, I will not leave you here. I went and carried my stick. I said, I will beat you until you feel this. And then when I said that, she busted into laughter. She started laughing. He said, this woman, I've heard about you. I said, okay, so can you clean your face and tell me what? And she now told me all the story, how the husband wants her dead. The husband will even tell her, I know you are going to die very soon. So I don't even bother about you. I spent all my money before, and now you are coming again with this kind of thing on your body. You are a witch. So after she told me all this, she was saying that she was crying. I told her, I said, okay, Somebody directed you to me. She said, yes. I said, are you going to listen to me? Will you do everything I tell you to do? She said, yes. I said, okay. I brought a paper. I said, write and sign. Matron, whatever you are going to tell me, I am going to do it back to back. And she wrote it and signed. I said, okay, let's start. Now, I want you to leave this place. Remove your hair tie. She removed it. I said, what is this? Go straight to the barbing shop, barb your hair, do low cut, very fine low cut, and put a dye. Let them dye, spray a little dye here. You said that? I said, yes. Did you hear me? Have you forgotten what you signed? You said, yes. I said, put a dye on it. Let them dye a little bit, just a little part on your hair. And then enter market, buy bomb shots, buy like 4. Buy good blouses, different types, sexy ones, and then collect your palasa phone doesn't make any meaning. Go and collect your phone from your daughter. Tell her to download good music that you love, whether secular music, religious music, just download anything. All the ones that you love, let your daughter download it. And then buy MP3. When you get home, start blasting the music. Start singing. Just be singing. Just be happy. Just sing. He said, with this thing. I said, yes, with that thing. Start dancing. Wear your bomb shorts. She laughed. Though. He said, Matron, I don't wear trouser. I said, you are going to start your undertaking. So you are going to start. She said, Matron, she went on her knees. She said, this is the last time I will cry. I'm going to do everything that you are telling me. And that lady left and went and did it. The third day she called, I'd even forgotten about her. The third day she called me, said, Matron, guess what? I said, what's happening? He said, I started playing music everywhere. I've been dancing the whole place. And I noticed by the third day that the pain has subsided. The pain just went down on its own. Matron, I can put my hand down, even with that fat thing, that big lump on my armpit. I said, that's just the beginning. I said, how about your husband? He said, the man is thinking I'm mad. That the man will be standing somewhere and hiding and looking at me. And I was just dancing and I would prepare food and we'll eat. And then later he now came and said, Madam, has the cancer entered your brain? He said, no, it's Holy Ghost that entered my brain. Don't worry, I'm fine. And then as she kept doing it, because she was attracting joy, she has dissipated that fear. It started attracting positivity, started attracting good people to her. And then one person that she had been talking to, she has spoken to a lot of people. She needed money for her treatment. One lady called her. He said, I'm going to pay for 3 of your courses. And she called me, see, it has happened. Somebody want to pay for my chemo. 3 sessions. But what? I said, hey, stop it. What is the meaning of what? Go and start. He said, how about the 3? I said, go and start. Please don't try anything. And then she went, the first chemo this lady took, she said when she got there, she was playing her music. She was talking to it because I have told her what to do. They say, when you go there, I said, you this chemo, I am in charge of my body. You cannot rule me. You are the one that is going to respond to the treatment. I am not going to react to it. So you chemo work for my body. You have to locate every cancer cells where they are and kill all of them. She said when she was talking, the nurses were looking at her, they were laughing. She did not care. She said, you this chemo, you have to respond. You have to respond. You have to, and I must not have any side effects. Clear all the cancers in my body. And it was only one doctor that said, that is good. And she took that one chemo, that first one. By the second week, the tumor disappeared completely. Nothing was found on her axilla again. She had to rush to come and meet me and removed her clothes. Say, check. There was nothing. The axilla was flat. Nothing was there. And the doctor said, we've not seen this type of thing before. And so she continued it. By the third one, the doctor said, go and do CT scan. Let's see. She did CT scan. They didn't say anything again. Then they gave her the fourth one and said, go for radiotherapy. And she asked, should I go? I said, go. And then God helped her. And she did, and everything went perfectly, healthy, and strong. What can you say about that? Time
Thank you so much.
controls our body. Our mind controls, directly controls your body. You cannot survive above your mindset. You cannot get anything right different from what you are thinking. So you need to keep track of your mind. Track it, track it, track
Thank
it.
thank you so much. In fact, I'm already tearing up. I think it's the story, and I've heard loads of things about people getting healing just because they changed their mindsets,
Yeah,
not necessarily because they were doing something different, but the fact that they believe they will live.
yeah.
And then when we share perspectives about things and events, people get to a point where they feel so safe. So I hear you, and we've seen that happen in so many cases.
And
But
then,
then I
sorry,
want to
our
bring to
husband
your
changed.
notice. Sure, because you've already changed the mindset at home, and everybody will have to follow suit. But there's this question I want to ask. There's someone's hand. Please, if you have a question, please share in the chat. If you have a question, share in the chat. If you have a question, please share in the chat. If we have time, we can unmute some people, but it's most importantly, we can use the chat so that we'll gain more time for Metron to speak with us. Metron, I know that it's easier to talk about um, us walking through our mind, but it's very, very difficult. There are those where you feel so helpless, and all
Mm.
you're thinking is, will this ever go away? All you're thinking is about, yeah, you say, well, we can forget, but what do we do in situations where you feel so helpless and you feel like giving up? Especially when sometimes on the group, people will just, I remember when someone said something about his metastasis, and I feel I don't want to take on treatment anymore because there's no hope. And you caution the person. What do we do at those points where when we feel so helpless that we just want to give in? How do we get our mind to reconnect with us being positive and not keep trying?
Okay, I will actually go back a little. I will still
Yes.
come. I want to say this before you get to that point. If you have not gotten to that point, you need to keep yourself in check, because these things, these negative vibes is very creepy. It comes in and you do not suspect. You don't even know that you are having this fear that is escalating to something else, because once it goes to anxiety, you start having panic attacks. A lot of things has gone wrong, and most of this time the treatment is not working again. And so you need to first of all, you need to recognize it when you start having these fears, because when it is creeping in, you don't know. It comes so subtly that you don't really know that there is any fear there. You just thought it's normal, but it is building up. And so you need to nip it at the bud. First of all, have you ever, the first thing is for you to recognize it. Recognize that you are having this problem. Don't try to wave it. Don't use prayer to cover it. You have to assess yourself. Every day, assess yourself. Do you have anything that is making you feel that you are not happy? Yes, good. You are not happy in the first place, but you wake up in the morning, you don't feel like getting up from bed. You are staring at the ceiling. You are reluctant of standing up. Your mind is blank. You just feel lost. Something is wrong. Do you feel you are sitting down? You feel that your shoulders are tensed up. You are tensed. Your body is tense. You are sitting down. You didn't know that you are grabbing your legs. You are holding your legs very tight. I know there are people that feel that way. Or you are holding your phone, you realize that you are holding that phone too tight. Something is going on inside of you, which you need to arrest it. So that, and then you discover that you don't have pleasure in anything. Depression is sitting in. Once you are depressed, believe me, that treatment will not work. Nothing will work. So don't get yourself to a stage that you will not be able to do that this thing, because once those people that put that, most of the time they private chat me and I talk with them. Depression has set in, and there is nothing much you can do about it. What you can do with such people, like I normally do, to refer them to see a psychiatrist. It Because once you are depressed, your body works against you. The treatment works against you. So they need to give you something to calm your mind, to calm those chemicals. There's electrical impulses that is going on in your brain and is causing a lot of damage to your system. And so no matter what you are giving, okay, what happened to people that they have given them few days to live or few weeks, okay, they are going to die. They've took, like one lady, they gave her 3 months to live, and we worked together. Yes, she finally left, but she survived almost 2 years. She was given 3 months, 3 months, because the condition was really critical, and yet she pulled through. The day we went to the hospital for the last batch, the doctors, they were like, "How is this lady surviving? Tell her to relax." How is she surviving? How is she staying up to now? Because she had that will to live. She had already changed her mindset, but she changed it at the time that her body system has completely deteriorated. And secondly, there was no money. When money is an issue on its own. When there's no money, you say,
We'll talk
like,
about it.
who said, take this, use that, use this. And then you look at it, Matron, how much? Okay, oh, let me depend on God. And so when it gets to that, your hands are folded. And
Yes.
that is why when I see people that are throwing money everywhere, they cannot spend money on these ones. It's so painful. It's so painful. So such people with this condition, they need to see a psychiatrist. I'm not mincing words, because their mindset has to change. Okay, I knew about somebody that was told that she had 6 months to live. She didn't really do much, but her family took her somewhere in the village. Just say she should just the plan was for her to stay there and die. She got to the village and they were giving her fresh vegetables, eat this. She was just eating, and then they were giving her coconut water. She just kept drinking coconut water non-stop. And then all of a sudden she noticed that her strength was coming back. And then she had a different view with the people in the village. So at times, leaving your environment completely helps a lot.
I agree. I agree totally. I agree. Like, because sometimes you need to change your environment, change your friends, and start talking with other people. Thank you
Yes.
so much for sharing. There's a question in the chat, even though it will take us off a bit from what we are discussing, but let's capture that because the person might drop off anytime. So let's respond to that. She says, why would why should a doctor give a medication, chemo, and later change the medication because it's not working, knowing the effect and high expense of the medication? Can they check your body metabolism before prescribing?
Now, I
Mm.
want to say that you should not blame the doctors for doing that. Now, the doctors, they have a regime that they use. For triple negative, these are the drugs, the line up drugs. The first stage, the second level, the third level. They have line up drugs that they need to give for people that are triple negative. And then, or if the case is maybe stage 3, stage 4, they know the dosage to use. And this is laid down. They don't just get, that's why you can go to one hospital and the doctor writes a particular chemo for you, and you go, you said, okay, you want a second opinion, and you go to another place, the doctor writes the same thing to you. Now, before I used to follow some patients to the hospital. I used to follow them. In fact, all the consultants, the oncologists, they know me. And last, I used to follow them there. And I used to fight doctors too. So, yes, I used to challenge them a lot. So, this patient was given a diagnosis and was given some line of chemotherapy. She finished it and she was not responding. And the doctor, they now told her, like, we are going to give you another one. And she called me, what do we do? I said, okay, can we go to another hospital, private cancer center? And we got there. Guess what? It was the same medication that was given. So in essence, what I'm trying to say is that, like I used to write this, put in the group, and I will still say again, cancer treatment is trial and error. Here
Yes.
in Nigeria. It's trial, even outside the
Everywhere.
country.
Yeah.
It is trial and error. It's just like now, for instance, you have malaria and you now take artemether and you take it and you are still having bitterness, you are still having the headache. What do? You go and buy another one. You have gone to do tests and the doctor said you are having malaria 1+, just 1+. And then you have taken artemether lumefantrine, which is the generalized drug that they give to malaria. That's the generalized one. The same thing with cancer treatment. They have the one that they give to cancer patients. So after taking that malaria drug, the doctor has given to you, and it did not work. What do? Most of the time, we don't even go to the hospital again. You go to the pharmacy and you buy another type. So that's the same thing. It's trial and error. Unfortunately, it's trial and error. So you can't really blame the doctor because the doctor will not know which one is going to work for you. But like I said, your mindset can work for you. Your mind can work for you. Your body system can make that treatment not to work for you. So it is no doctor's fault. And there is nothing like we are going to do some. Yes, abroad there are some tests that they can do to see the percentage of your response. They see the percentage of your response and they will know whether you are going to have a recurrence. But right now here we don't have such. And so we depend on what we have by taking the chemo. But first of all, please try work. We have not even, time is already out. We have not even talked about how to handle this, your mindset.
Mm.
So I'm sorry, there is really nothing much the doctor can do than to. That is why we always said after your third chemotherapy, please insist on running some tests to see whether you are actually responding or not. They can always change it by the time you are taking the fourth one. But there are some people that will do. I have seen a lady, even in the group, she took this chemo, the 6 courses. By the time she left, not one or two, she's going for radiotherapy. They discovered she had metastasis to the spine and it has affected her lungs. 6 rounds of chemo. What happened? She started chemo with no metastasis and she ended with metastasis. And not just a little, the spine was involved and the lungs involved. And I asked, did you do a check after the third one? No. And the doctor did not do that check. And so why are you in the group? Because we sing this every time. So you have a part to play also in your own treatment. Don't leave everything for the doctor. If your doctor forgets that you're supposed to do a check, sometimes the doctor will say, okay, I've checked you. You just come and touch, you lie down and touch, you say, go and continue with your chemo. Most of the time, I don't blame them because you see one doctor attending to too many people at the same time.
Yeah, that's a problem.
So they are overloaded with so many cases. So, but you can help yourself. I remember that was one of the reasons I stopped going to Luth. I followed the patient to Luth, and the doctor had already, oh my goodness.
We can still hear your voice. Go on,
Okay.
ma.
The doctor, the the doctor told her to, what was I saying? This NEPA, they just,
You followed someone to lose.
yes, I followed her to Luth because she, after her third chemo, I told her she needed to run some tests. And the doctor said there was no point. She should continue with her chemo, that everything is fine. And so I now told her, please go and do this test, do this test, do this test. And let us go together and see your doctor. And when she did the test, guess what? Metastasis in her lungs. And she was supposed to continue with the chemo. And so I followed her to the, when we got there, and I now sat down. The doctor said, who are you? I said, I said, I am so person. She's my sister. He said, all these nurses, what are you looking for? I said, she's my sister. I said, okay, so what is it? And I presented the result to the doctor. Said, sir, I told her, or ma, is a lady, I told her to run this test. She's going in for the fourth chemo because she has not done it. He said, who told her to do it? Are you the doctor? Are you the one treating her? I said, please, can you just have a look? I brought it out and gave it to her. Guess what? She collected from me and flung it on the floor. Say, madam, you don't want to do your chemo, you can go home. What gave you that right to come and sit down here and you told this one to go and do chest CT scan? Who told you to do it? Are you the one treating her? You can take her home to go and treat. Trust me, I exploded right there. We started I was shouting. Security people came in. Luth. I started shouting. We started exchanging words. And I was showing everybody, look at this woman has lung metastasis. And she's taking the same chemo, she's going for the fourth. And then the medical director then heard it and came, because it was really big noise, came and said, Matron, is you, I know you, what's the problem again? And I said, sir, look at this result. Look at this woman with lung metastasis. And she's going for the fourth one of the same chemo. This woman started this chemo without metastasis. Now she's having metastasis, and the doctor is angry because she didn't do her job. And I'm telling this woman to do it. And that was why everywhere was quiet. And the medical director collected the result, looked at it, and took me and this doctor to her office. And then I don't want to say what happened after that, but after the whole thing, we became friends. We became
I like that. I like that.
If there was no intervention here, the woman would have completed the chemo. By the time she finished, the thing may have even entered her spine or any other part of her body.
Thank you so much. Thank you so much, Matron. I'm looking at the time.
Yes.
Wow. We have a lot to cover. And just like you said, we've not talked about how to really work on your brain, on your mind. And that's where we are going now. Even someone in the chat says, I'm just coming in. Please, how can I work on my mind? Is really important. I know the negative thoughts are there. So we are going to go in details, just practical things that we can do to actually work on our mind, to get our mind to like work for us. And what can we do to get our mind to work for our body? Practical tips that we can use.
Okay. Like I said, number one, you have to recognize that you have a problem with your mind. And then you be able to pick out those things that is bothering your mind. You just need to, because if you do not recognize what is causing that fear, if it is the fear of death, if the fear of, because there are a lot of things that brings out this fear of
Morning.
money, fear of metastasis, fear of what other thing again? There are a lot of things that causes fear. And so when you start recognizing what is causing this fear, you can write them out. It's always good to document. Write down, if you really want to deal with these fears, write them out one by one. And then you see how you are, because once you have identified the problem, then solution is not far-fetched. So recognize what is giving you these fears. Take care of little things that do you think they don't matter. Like I said, take a look at all your responsibilities on an average day. What are you supposed to do? What do you do on that day? Involve yourself in activities, because they said an idle mind is the devil's workshop. Get yourself busy in doing the normal things you need to do. Find happiness. One of the ways to find happiness, I keep saying it, is play music. If you are depressed, number one treatment is music. Play music, let music become part of your life. Just let it keep flowing. Let it keep flowing. Let it keep flowing. I remembered in the Bible when Saul was having mental problem. Who helps? Is the music that David was playing. And he now recognized that it was music that he needed. And so that music kept keeping him going. He didn't take any psychiatric drugs at those days. It was just music. So, and again, when you are going for an appointment, you have an appointment, it's not the time for you to start getting worked up and being afraid. 3 days to that day, become excited, pack your things down, be positive about what, be deliberate. That is all I can say. Be deliberate about being happy. Be deliberate of liking what you're doing, even when it doesn't seem right. Just like it. Just be happy. Okay, I'm going for my clinic. You can even, like I normally encourage people, when you are going for a clinic, just put it some days before, and that day prepare yourself, pack your things, get yourself ready. Not that that day you start rushing, get everything ready and be positive that where you are going to get your treatment done, and that you're going to respond to it. Make friends and make appointment with friends. Stop being, there are people that are so, they don't want to associate with people. Even in the group, they don't talk about their problems. Please try and make efforts to share. At times I will ask a question, nobody answers. Why? Because at times I just put something, I want people to talk. Let it be a time for you to discuss. The more you talk, the more you free yourself. I want to say something about talking, because people feel that you don't have to. When you start talking, you release some kind of positive energy into your body. You feel better and more in control when you are talking, when you are saying so. You know, for instance, if you want to pray and you are praying in your mind, do you know that you don't really feel the impact of your prayer? Just think about it. You are praying and you are doing it in your mind. You don't feel that impact of that prayer. But once you start voicing out, you start talking, you start praying, you discover that there's this something that makes you feel good. That this something that makes you have that faith that something is working, even though you don't see anything. But the fact that you have opened your mouth, it,
Very correct.
it makes you feel. He said,
She said very correct.
I said it's very correct.
thank you. It makes you feel happy. It relieves stress. It makes you feel less alone. It makes you feel less isolated. It makes you feel less overwhelmed with what you are going through when you talk. Open your mouth and talk. When you are closing your mouth, say bacteria is inside your mouth. Open your mouth and talk. When you talk, you discover that it increases your trust and strengthens your bonds with other people. And then it will help people to even support you. If you are not talking, how are you going to get support? How are you going to know that somebody knows what is in your mind? You can just say something and then you discover that people comes around to help you. So you need to talk. You need to talk. You need to help yourself by voicing out. Share your mind. At times I will say share your feelings in the group. Nobody wants to share. Share. Try and be realistic. Talk about what is okay. Flourish. That was what you did. You had cancer, you did not keep it. You started making noise about it. It
Mhm.
makes you feel good. And I'm very sure if you did not start like that, you won't be where you are right now.
Sure. Sure.
So you need to talk, you need to share, and you need to listen to other people. Don't just wave it aside. When you listen to other people's experiences, it builds you up. It gives you like a kind of, you know, route for you to take. It might not be exactly that route, but it will give it like a yes, so you begin to walk towards it. And then it gives you hope that somebody did it. If you don't listen to another person's positive history, how would you build yourself? I
Mm.
realize that when somebody, or even myself, when I post somebody's positive story in the group, everybody is happy. They start praying. And so it gives you hope. By so doing, you are removing that fear from your body. Now, another thing is learn to cook for yourself. It might look very insignificant. Go to the market by yourself, buy things, come and cook for yourself. You will appreciate it more than anything. You will
Me-
love what you're doing. Yeah.
Metron, when we are sick, we don't even have strength to go to this market and to
Okay.
even buy the things that we are
Exactly.
going to cook.
Yes,
So what do we do?
yes. When you are sick, you don't need, one of the things I'm about to say is that don't push yourself more than necessary.
Yes.
Operate within the defines of your energy.
Mm.
No, your body is the best teacher. Your body is the best counselor. Your
Mm.
body is the best physiotherapist, because your body will tell you stop.
Mm.
That when your body is telling you to stop, that's when you keep pushing. So I'm not talking in that scenario. That's some,
Okay.
because they are diagnosed with cancer, they don't want to do anything again. Somebody should go to the market. If you have the energy to go to the market, please go. You will appreciate it. You come back and you feel tired. A little stress is good.
Yes.
A little stress is good. If you are staying in bed, you are lying down doing nothing, that is when your mind will be going up and down. So you need to think of how to be active as much as possible. And again, I want to say this: you are not obligated to be cheerful at all times. And to be, don't pretend that nothing has changed since the diagnosis, because that is a very wrong platform that you are staying on. I said two things there. You are not obligated to be cheerful at all times. It is allowed. There are times you wake up, you feel very unhappy, you feel very sad. It is okay to be sad, but don't dwell there. And don't feel guilty that you are falling back. When you feel you are down, please rise up. You see, this our brain is like a field. Anything can enter, everything enters, but you are the one to drive the ones you don't want. So you need to be deliberate about keeping your mind positive. Read books, read books, watch comedies, keep yourself happy. Take your mind off negative things. Stop reading bad news. Stop watching horror movies. Just go for something that makes you happy. And then when you do that, you discover that this negative thought, there is no how you can remove it completely. You can't. It has come to stay. Everybody has it. Cancer or no cancer, everybody has this negative fear, this fear of even death. Everybody has it. But then you should be able to know, you know your body, you know how to do it. Get it out of your mind. But the most important thing is for connecting with people. As long as you're connecting with people, you will stay afloat. Because when the time comes that you're not feeling okay, you take your phone and call someone. I don't know, I'm feeling somehow today. And then you start talking. Along the line, you discover that you are laughing.
Mm. Yeah.
And then don't forget, if you are a Christian, don't neglect going to church. Don't stop connecting to your church and your pastors. Your activities in the church should be top gear. You are a Muslim, please make sure you read your Quran and be sure that you are going to the mosque. If you cannot go, you can connect. Thank God everything is online now. You can connect. So just keep yourself busy. I remember recently that I was down. I could not walk. I was in orthopedic up and down. And I was always connecting to everything because I couldn't walk. I was connecting to everything on my TV. Anything that will make me happy, anything, music, I can just leave music to keep flowing. So that my mind, because once you are, especially if you are ill at this moment, you are not active. Please keep your mind busy on positive things like listening to music, watching things maybe on your phone. Just keep going. Talk to people. Call Matron. If you don't call me, chat me. Yes. That
Thank you so much. Okay, thank you, Metron. I'm looking at the time, and we've already passed the time, but there are two questions in the chat. I know we are going to bring you back on the platform to really get deeper into this. I'm so excited. I don't know why, because sometimes on the group, like you may send something, and for some of us who are really like busy all through in the morning, the evening that we want to read it, loads of messages, and you're so I like the fact that you are talking. So we'll make this a more frequent thing for you to just have time to share with us. It makes it more engaging. But I need us to answer this question because I'm also curious. So when you said, I don't think there was any particular test I did after my third chemo, except the fact that they do blood before every chemo. I'll do blood work. I don't think there's any particular test after the third one, even though because I was positive about it and I was everywhere. Sometimes I don't even remember that I have to like think about the whole chemo. Meanwhile, I'm taking video to that I will post, and I'm excited. I'm running everywhere. I'm going to school. I'm teaching. I'm doing all that. So it might be that's why I didn't feel the impact of the chemo. But what are the recommended tests to do after your third chemo that can reveal that you responded to treatment or you are improving? Someone asked that in the chat, and I'm curious to know what tests should we, because some of these doctors, they're not telling us, should we request that we go and do to be able to know whether these things are working or not?
okay. Um First and foremost, the test that I always recommend is just chest CT scan. Because the chest CT scan, most of the time when cancer is metastasizing, it goes straight to the lungs and the spine. Those are the two places it attacks first. And so when you do chest CT scan, it will show your lungs and it will reflect on your spine also. To reflect on your spine. That is why, like there's a lady I told her to go and do chest CT scan, and then it happened that the thing showed that she had metastasis in her spine from that chest CT scan. So I now told her, go and show it to your doctor. This is what is happening to you. And unfortunately, that was her fourth chemo. She was just feeling uncomfortable about the whole thing. She was scared. So I said, okay. She said she doesn't know whether this thing is actually working. And I told her, and she had metastasis. I have done this to so many people, and some people comes out clear. Some people comes out, the cancer is actually spreading. That means the chemo was not even working in the first place. And I always ask this question. Somebody that is having breast cancer and they cut the breast, can't that chemo work for that cancer inside that breast, with that breast there?
Hmm.
Why is the cancer not treating the cancer inside the breast? And then you see somebody taking chemotherapy, and then the cancer is already affecting the second breast, and the person is on chemo. And that is why I'm always going back to healthy living. I'm always going back to healthy living. Modification of lifestyle, holistically. Holistically. because chemo treats the symptoms. It does not touch the stem cell. And then you see it is back and front treatment. So that is actually you see what you just said now. I just I just hope people were able to get a grasp of what you just said. You were taking chemotherapy, your mind was not there. You were running around doing every other thing. And so you didn't even know that you were taking, it didn't even occur to you, okay, I'm taking chemo, not taking chemo. That is how it should be. When you station your mind on it, you're going for chemo. Hey, just get ready to receive what the chemo is going to give to you. So you need to diversify yourself a lot for you to be able to scale through this thing. So it is just CT scan, chest CT scan, I normally tell people to do. Except you are complaining, like a lady was complaining of back pain around the lumbar region. She was complaining of pain at the lumbar region, and then her doctor told her that it is maybe lumbar spondylosis. She should continue with her chemo. And when she told me, I told her, go and do CT scan or MRI. And she did it. The cancer was there on her lumbar region and the pelvic bone. So she went back and they had to change the chemo. What if I didn't tell her to do that? She would have completed the chemo and it would look as if she has not done anything.
Okay, thank you so much. There's a lot happening. There's a lot that we need to learn about dealing with cancer. It's like you said, it starts with your mind. It starts with the things that you want to continue or discontinue. In fact, if we start talking about things to do, from whether from eat, what to eat, the exercise, the everything that you need to incorporate in your healing, we are not going to live today. And
Yes.
that's why we are going to bring Matron back to talk to us about those things, about our food, about our exercises, about every other thing that we need to do. But we are going to round up now. And so I'm going to ask, I don't think there's any other question in the chat that we've not answered. So I'm going to ask, okay, someone asked, please, stage 4 metastasis. To the brain, what are the chances of survival? Matron, for you to answer this question, I need you to also like summarize everything you've said and bring us to a closure. Yes, stage 4, metastasis to the brain, what are the chances? And just before you respond, I want to share this with somebody. If an aunt, a colleague of mine just sent us something from South Africa. She went for her, this is her 8th year of being surviving cervical cancer stage 4. And she went to South Africa just to check. Every year she goes to check. And just for you to know that whether stage 1, last week we saw doctor stage 4 cancer as well, who healed. So I don't know, but let Metron answer. I feel that there is always positivity when we bring about all the stages. In fact, at a point with my own, I stopped asking doctor, which stage am I? It doesn't matter. I don't care. Don't tell me, go myself. Just if you say this is, let's walk through it and let me focus my mind into, okay, there is cancer. Let's deal with it. Whether stage 1 or stage 2, stage 3, stage 4 is irrelevant at this stage. But then your mind will also help. So, Bertram, please round us off by answering this question and just wish everyone well. We'll come back to discussing the details, the food, the exercise, and everything that we need to do as we continue on this journey of healing.
Okay. Brain metastasis can be very scary. It can be very, very scary. But then people survive it. Brain metastasis is not a death sentence. It is not. It still goes back to doing what you're supposed to do and keeping your mind positive and happy. Look forward to living your next 60 years on top of what you are your age at this moment. I know a lady that had metastasis to the brain. She's still alive today. That was like 6 years ago. She's still alive. The rate was so much that she had the tumor was so large that it was pushing her eyeball out. The thing pushed her eyeball out. And at first they were blaming her. Why did you leave it this long? You were having headache, you did not do, and then you started seeing your eyeball changing, coming out, you did not do anything. And actually she was praying. Please, prayer is good.
Mm.
You do what you need to do. Prayer is good, but don't put your mind on that. See, God is God. You cannot put God in a test tube and tell him this is how you are going to do it. If God wants to use drugs to treat you, chemotherapy, how will you know if you did not try it? Why are you saying I'm not doing it? I know God has healed me. God has healed you and the cancer is still there. Yes, have all your positive thinking and everything, but please do the right thing. I'm not against any kind of treatment you are taking. If you are going to orthodox, please do it. If you are going natural, please do it. If you are doing orthodox, natural, you have to mix everything together. But the thing is this lady went and they removed this tumor from her head. And they could not remove everything. They were not able to remove because there were some sensitive parts in the brain that they could not touch. So they left it. And then she came back and said, I'm done. And I said, see you in the next 30 years. And she said, see you in the next 30 years. And she started living her life. And as a matter of fact, the metastasis caused a pathological fracture on her leg. She had fracture on her leg. She was using walking stick. With that metastasis, that lady is living her life. When they thought she was going to die, she didn't. She did all that she was to do, but she reduced everything that she's eating. When it is time for her to sleep, 9 o'clock, there's nothing you can say she's asleep by 9 o'clock. No stress whatsoever, because it's not like I said, okay, we are talking about brain is far away. How about just ordinary breast that the chemo cannot even cure breast cancer? They have to cut the breast. Chemo cannot kill breast cancer. If it could kill it, why did they cut the breast? And then they cut the breast, they do radiotherapy, the thing still spread. So it is not something to even depend on that way. And so this lady is living her life with the fact that brain, they couldn't remove all the tumor cells. It was still there, but she continued living. She keeps going for her treatment. She keeps going to the hospital. They will check. They say the tumor is regressing. It's regressing. It's regressing. It's regressing. And she's still there moving up and down with her walking stick. 7 years. If you are having brain metastasis, you are going to live. You are not dying. You will survive it. But
Amen.
just take all the instructions that we are enforcing. Just go by those instructions. Do all that is necessary. Stay off fear. Work on your fear. If you're having fear, take a pen and paper. Write it down. Write all the things that's. Do you know that as you are writing, it slows your mind down? When you are writing, it slows your mind down. And that is part of what you need for healing. Somebody with brain metastasis should not involve in too much thinking, should not involve in staying awake at night when you need to be sleeping because you need melatonin in your body to start working on that brain, and you are awake 11, 12, 1, you are still awake. You should be sleeping. So I want to conclude by saying that your visualizing your healing, visualizing your healing, becoming a real champion, a real warrior, has to do with your mindset. We have seen that even chemo has failed a lot of people, but your mind cannot fail you. You can
Yes.
make that chemo to work for you. You can
Yes.
make your drugs to work for you.
Yes.
Even when if you are taking natural things and your mind is still going somewhere else, it will not work. So everything depends. Your mind connects with your body. They work hand in hand. They are husband and wife. So don't try to separate them. You are having fear and you are treating your body, it will not work. So you need to be conscious of your mind. Have um make a conscious effort to control your mind. Deal with it. Deal with difficult and recurring thoughts. When the thoughts are coming, ignoring those thoughts that are coming or trying to distract yourself may work at well for the first time. But after some time, it will not go away. When you are trying to ignore those nagging thoughts, when you ignore, I want to round up by saying, don't ignore those dangerous thoughts in your mind, those negative thoughts that are weighing you down. Don't ignore them. Identify them, write them out, and start working on them. If you feel you cannot handle it, please see a psychologist. Talk to somebody. Don't sit down and if you sit down and say, if I can't do everything I used to do, I'm useless. I'm a burden to my loved ones. I'm a burden. I'm next to die. Once you start making the nobody can help you at that stage. Nobody except you help yourself. Imagine you are saying all those ones and you think that they will not apply to your body. It will. Check the reality of your thoughts. Ask yourself, am I jumping to conclusions? Check the reality of your thoughts. Those things, 80% of what you are thinking is false. Those things you are thinking, they are not realities. They are not going to happen. So check the reality of what you are thinking. Is it actually true that you are going to die? Is it actually true that this thing is not going to work? Check the reality. Have you ever done that? To check the reality of what you are thinking, what is causing that fear? And then acknowledge small achievements that you are making, small efforts that you are making. Acknowledge it, be happy that you are taking positive steps. And then practice letting your mind come and go. Don't let it stay on one particular thing. Let your mind go. Don't allow your mind to dwell on one thing. But if you feel that you cannot do it, please seek
Help. Seek help.
help. Thank you.
Seek help. Thank you so much. Thank you so much, Metron. We are over like almost 6:30 and it feel like this should not end. But we have to go. Thank you everyone for joining and for asking your questions.
And I still have
Usually
mind.
you still have what did you say?
I said, and I still had so much in my head to
Yeah,
release.
yeah, we are going to come back and bring you back. This session, we usually have it second and third Thursdays of every month, and we'll bring you back to keep sharing. See, the most important and the reason why I started this talk show is because people need the knowledge. And that's why I called it I've Got Cancer, so what? And because I know people, you should not talk about cancer. It's this one, hide. No say anything, stigma out there. I always tell people, I never experienced any stigma. Because where would you stigmatize me from? Already my all my stories on LinkedIn, on social media, everywhere that I have cancer. So what are you going to stigmatize me on? What, before in fact, I don't even know how to say it. So the more we hide as cancer warriors, the more we feel depressed, the more we feel, oh, people will talk about it, the more we, my hair is, I've cut my hair, this one, that one. Says who? The first time I had the session, somebody asked me, I think the 25th of August last year, last year, somebody asked me, will cancer warriors find love again?
Hmm.
And
Interesting.
it was so Metro, let's not go into that. We are going to come back and talk about love, because there are lots of stories, even from the group, like even marriages, even without breast entirely. And
Yes.
so it's so beautiful, the amazing things. And in fact, that day I had to share a colleague of mine who God, married the best woman on earth, even with stage 3 cancer to the head, like to the eyes, but they could not do operation because it's connected to the brain, and he had to go through chemo and radiotherapy, but he found love. He
Wow.
married. Yes, he married. They got married in November, and they are living beautifully.
Wow.
Let's not go there. But what I'm saying is, this life is so beautiful when you decide to live your life despite what comes to you. And with that, we are going to close out. The video we are going to share in our YouTube channels, share the link. Please keep listening to it. The way you listen to music, keep putting the right words, the right sentences, the right people, the right support around you. Sometimes I don't talk in the group, but I can even go behind this and talk to Matron. Build that relationship. You need people with experience. You need love. You need attention, and don't shy away from the
Yeah.
fact that this has come to you.
Hmm.
Count yourself lucky to live among
Ac-
people. Yes.
Acceptance.
Yes. Thank you, everyone, and have a good evening. Bye
Thank
for now.
God
Thank you
bless
so much,
you.
Metron. Thank you so much. If there are other
It was
questions,
nice being here.
anytime. Nana, what did you say?
I said it was nice having the matron here.
Yes,
It was a fulfilling one.
yes. Thank you. Thank you, Metron. Thank you, Metron. We are going to call you back. We need to talk about love. We need to talk about marriage. We need to talk about everything. God bless you.
God
Thank you,
bless
Thank
you.
everyone.
you
Have a
very
good
much,
Thank
Matron. God
you,
bless you.
Matron. We
Thank you,
appreciate
ma.
you.
Thank you so.
thank you. All right. Good night, everyone. We'll
Good
stop
night.
recording.
Good
Good night,
Good
night.
night.
Thank
ma.
you.
Bye. Good night.